Pain is one of the body's most powerful communication tools. It's a signal, a message from your body telling you that something needs attention. But not all pain means the same thing, and understanding what your body is trying to say can make all the difference between safe recovery and unnecessary suffering. So what exactly is pain? At its core, pain is your nervous system's alarm system. When tissue is damaged or under threat, nerves send warning signals to your brain. The brain interprets those signals, creating the sensation we call pain. It's your body's way of protecting you, prompting you to stop, rest, or make a change before further damage occurs. There are two main types of pain, acute and chronic. Acute pain is short-term, like the sharp sting when you twist your ankle or the ache after a workout. It's your body's immediate response to injury and usually fades as healing progresses. Chronic pain, however, lasts beyond normal recovery time, often persisting for weeks or months. It can be linked to long-term conditions, past injuries that never fully healed, or even stress and nervous system sensitivity. Pain isn't always black and white. Sometimes you can feel pain even when no tissue damage is happening, like phantom limb pain or tension headaches. In those cases, the brain's alarm system becomes overly sensitive, sending alerts even when there's no real danger. So how do you know when to rest, move, or seek help? If pain is sharp, sudden, or severe, especially after trauma, stop what you're doing immediately. Swelling, bruising, or inability to bear weight are clear signs you should see a healthcare professional. If pain is dull, mild, or linked to soreness after activity, gentle movement and stretching may actually help. This kind of pain often signals adaptation, not damage. If pain persists beyond a few weeks, worsens over time, or interferes with sleep and daily activities, it's time to get it checked out. Persistent pain may point to an underlying imbalance or condition that needs attention. Remember, your body doesn't use pain to punish you. It uses pain to protect you. Ignoring it or pushing through can lead to bigger problems, while understanding and respecting it can speed up healing. Listening to your body means paying attention to patterns. Does your pain come with specific movements? Does it improve with rest, or does it stay constant? These clues can help professionals diagnose the root cause and guide your recovery plan. Modern science is also uncovering the strong connection between the mind and pain. Stress, fear, and anxiety can amplify how we perceive pain, while calm, confidence, and relaxation can help quiet the alarm system. That's why recovery isn't just about the body, it's about the whole person. The next time you feel pain, pause for a moment and listen. Your body is giving you valuable information. Respond with care, not fear. Rest when you need to, move when it feels right, and seek help when your body tells you it's time. Because in the language of healing, pain isn't the enemy, it's the messenger. And learning to understand that message is one of the most important steps toward full recovery.